share his screen. So he is going to talk us about how to write a manuscript. So what I am able to get from these talks is this is not only for the postgraduates to write their thesis and all. It is for every surgeon, for every physician to showcase their manuscript, showcase their work by doing this kind of writing a manuscript and publish their work. So I think so it's equally important for a consultant, for a practicing surgeon to showcase their work. So over to you, Dr. Venkatesh.
Yes, sir. So this topic is about how to write a manuscript for a journal publication. Of course, the concepts will be same for writing a thesis as well. So when do you write manuscript for a thesis or a journal or a conference abstract or for any research grant proposal or for any invited book chapters? So it has evolved over time, and we no longer write in papers and pens. So we do manuscript writing in the document form. So if you have the data in hand, be it a prospective or a retrospective study, so you have a clear timeline. Preferably, you should finish within 2 to 3 months, because if you keep on dragging, the concept and the focus will not be there, and you will forget what you have thought earlier. So better, and also split work among authors and start writing early. So if you see a publication, so these are the headings you'll be seeing, from title to background, objectives, materials, methods, that IM RAD format. So I will be covering each and every topic of this. And finally, once you submit, so what are all the things which you have to do, and what are the common mistakes that are done by the novice authors. So the title of the study, as was told by Dr. Terence, it's the most important part of any publication. So there are many articles get screened based on the title, and then followed by the abstracts, and then by the tables and figures. So this should not go wrong. So title should be clear, concise, and short, preferably. And we can write in 3 ways. So either you can describe the study, like here they have described what they did: prospective multi-center randomized controlled trial about PRP in tennis elbow. Or you can ask a question like whether this PRP works in tennis elbow. The other way is telling the conclusion of your study, like this works well, so this is giving so and so results. So you can either describe the study methodology, or you can ask a question, or you just tell your result, either positive or negative. So generally, like next to the title, you will see the name of the authors in any particular manuscript or something. After title, you will be seeing the name of the authors. So like not everybody involved in the articles need to be authors. Usually 6 authors are allowed for original articles. Case reports vary from 4 to 6. So the International Committee for Medical Journal Editors describe who is an author. And if they are not fulfilling the criteria of author, they should be acknowledged at the end, like statisticians or some mentors. So they should be acknowledged, and the affiliation should be mentioned. And if there is any source of funding, like any grants from ICMR or DBT, TST, grants from central government, you should be mentioning that. And of course, if the primary author gets any grant from the industry, it should be declared. So I recommend all the all the authors to register themselves in ORCID. So you will be given a number, ORCID number. So during publication, if you give this number, there won't be any like discrepancy in your affiliation or spelling mistake with your name, or those kind of simple things can be avoided. And ORCID keeps a database of all your publications together. Similarly, Google also have this Google Scholar My Profile. So that also you can update your all the articles, so that you will know what is your Hutch index and that kind of your citations in a single place. So like abstract, usually journals recommend 250 words or 300 words. It should be like a trailer for a movie. It should be clear and concise. Most of the journals expect it to be in a structured form, like introduction, materials, discussion kind of thing. And you are not expected to write any abbreviations unless it is necessary, like it's well-known abbreviations. And do not write any reference numbers in the abstract, Do not write like add tables or figures in the abstract, and you need not write all the data from the results. Only relevant data should be mentioned in the abstract. So most of the even reviewers get to know the abstract first before whether to accept to review that paper or not. So abstract is next best mirror for you to like it shows about your article next to the title. Okay, so then comes the keywords. So keywords is essentially for the electronic search engines. So preferably you use mesh terms, you search mesh in this PubMed, and keywords need not be the same in the title. So if you're allowed to give five keywords, you avoid those keywords already in the title so that the visibility of your paper increases. And so next to the keywords, like generally like we should write, start from the introduction or the background. Background around 500 words is common for most of the articles, journals. So we can write 2 or 3 paragraphs starting with the why did you start thinking about this study, like what is the problem and what are all the current solution and what is the recent developments or recent updates, but what is new or what is missing in the existing literature. So that should be mentioned. So that means that because of this deficit in the existing literature, you are doing this current study. And so at the end of the background, you state your hypothesis. So in the background part, you can quote latest articles, but preferably don't use some old references so that the viewers will know that you are up to date in this particular topic. So again, the background part should not contain any tabular column or any figures in general. So when you come to the aim of the study, it should include the primary research question and key outcome variable, and also preferably describe the study subjects as well. So when you're doing a study of comparing this DHS and PFN for IT fractures of hip, rather than writing it plain, you can write as comparing DHS with PFN in terms of the study parameters like operative time or blood transfusion requirement and hospital stay. And also like it can be a bit more specific in the fracture, like unstable trochanteric fractures. So make sure you are focused and not in a broader sense. So then the materials and methods part, this is the kind of part of the study. So only based on this, you are deriving the results and telling your conclusion. So materials generally like you can take 1,000 to 1,500 words. It should be divided into, to start with, you should write how did you select of course the study design, and how do you select the subjects, deciding on based on the inclusion and exclusion criteria. Then the sample size, and how did you arrive at the sample size, the power analysis. And if it is a prospective study or even retrospective, the ethical committee approval will be required, and you should mention a word about that. And followed by that, you should write elaborately about what are all the study design, like what are all the things which you did to the patient, leading to the outcomes which you are expecting. And finally, in the last paragraph of the materials and methods, you should write the statistical part. So relevant to your outcome parameters, you should write. And this R software is a free software available. SSPS only has free trial, but later you have to get paid version. Our software is free. So after this, while writing the results section, in the first paragraph you mention the key, describe the key findings rather than just writing the results. You describe the findings and use tables and illustrations with proper footnotes or legends for easy understanding. Don't repeat the entire thing that you have data that you have written in the tables again in the text format in the results. Only relevant things should be mentioned in the text, and do not fear about negative results. So this is like while writing in the Word document, you have many tools that you can use. For instance, to start with, the spelling and grammar check is a basic spelling check available in MS Word. Like in Google Docs, that has inbuilt grammar check. If you want Grammarly, you can add it. But for MS Word, there is grammar check is available. And you always put line numbers in your journals, in your publication, manuscript that you're submitting for publication. So you can interact with the reviewers based on the line numbers rather than telling second sentence in the third paragraph. If most journals expect you to send with proper line numbers, so while writing itself you have line numbers in your manuscript, and also stick to the word count. There are word counts. If you select the paragraph, then it would show how many words in that. You should stick to that. And you have add-ons like Zotero and Grammarly to check to insert references into the manuscript which you're writing. And of course there are comment section, and so that you can interact with multiple people it's both for Word document or for Google Docs. And there is something called track changes. So that this helps to know what are all the changes which you have done in the manuscript recently when compared to the previous version of the manuscript. Well, so this is for the previous discussion is about how writing the manuscript in general, particularly for the discussion part. The discussion can be from 1000 words to 1500 words. So in the discussion, to start with, you describe the study, aim of the study, and the key outcome which you have found out, and discuss about the results one by one, comparing with the existing literature, what are all the similarities and what are all the differences. So at the end of the discussion, there should be a paragraph for limitations. Some journals expect it to be numbered 1, 2, 3, or some they don't like, but you have to write the limitations of your study. So this is the part which reviewers will like to see, whether you acknowledge your own limitations of the study. So otherwise that questions will come to you after review, you have to answer them. And in the discussion part, you should use references freely to support all your discussions. And don't hide if there are any latest articles that is in contrast with your observation. You should not hesitate to quote that as well. But you should tell why your results are different from the other authors. And always the conclusion should be derived from your study. So there are a lot of authors who write conclusion part from the what is already known in the literature without in the context of their own study and study results. So that should not be the case. It should be based on your objectives of the study and your results. And mostly you're expected to authors generally give recommendations for future research based on your study, like your further large scale prospective randomized studies should confirm these observations. So such kind of stuff. So these are the main headings in any manuscript. So following which, acknowledgement for persons who are involved in the study not fulfilling authorship criteria. Also, if you got any grant or something, you can mention this here. And it is generally not used for acknowledgement in the thesis. Generally, in the first few pages, you will thank all from God, starting from God till your wife or husband, you will do, but not for the journals. So, references, or you should stick to the journal requirement for referencing. So whatever the journal requirement is, you first, while starting to write itself in Zotero or Mendeley, you change your citation style, referencing style in that, so that every referencing you add will be written finally it will be added in the required format. For instance, here you can see there are various formats. Generally, Indian Journal of Orthopedics, they follow Vancouver style of referencing. Vancouver can be superscript as well. So usually for case reports, less number of references, less than 10. And for original research, some 30 to 40 references are generally quoted. And for review articles, it can go high. And mainly for systematic reviews, the numbers will be more. And see, once you have written the manuscript, so you have done a phenomenal work. That's good, but still, it's only initial part. You have to revise multiple times, and you have to discuss with your guides and other colleagues. So before submitting, so that part is crucial. You obviously, with the poor grammatical sense, the reviewers will not be happy to correct your grammar mistakes while they are reviewing. So it's your part to send manuscripts without any minor errors. Preferably use simple sentences, avoid long complex sentences, difficult to understand things. And so commonly used techniques are like writing in font 12 new times Roman font, double spacing, and having side headings, so that in the Word document or in the Google Docs, and the side headings will be given separately in the left, so that you can go whenever you want to go to the other section, and you stick to the word count in each section. Well, there are multiple plagiarism checkers available. When you're submitting original research, it is advisable to check in any of these things. Grammarly have basic gram plagiarism check, but this Arcon uni check, so these are higher level of like plagiarism check. They're accurate. They will tell how much percentage of your articles are having this kind of plagiarism issue. Whether you did kind of directly copied from the text. Generally, journals accept somewhere between 10 to 15% of plagiarism. This is previously when in MGR University they had 20% of plagiarism acceptable. They now, I think the Arkund software is being given for all MGR University students for a plagiarism check. Well, there are free versions available to a basic extent. You can get ID from some of your friends who have access to these plagiarism checkers for your articles. When submitting the manuscript, you should you should find what are all the journals that had previously published similar articles like yours. For that, Elsewhere has this journal finder, and Springer has journal suggester. So you can put your topic and abstract. So they will suggest these are all the articles that had previously published, and there are high chance of accepting yours as well. So based on that, you can go. And obviously, you should check for this article processing charges before submitting. So when many of the international journals have this like concession for like low income countries based on WHO criteria. So India will have this kind of concession in this article processing charges. Look into that. So once you find a suitable journal, you have to write a cover letter. See, once your manuscript is rejected by a journal, so you should spend time to change from cover letter to the manuscript till the referencing. You should change according to the new journal. Mostly authors are a bit lazy changing these minor things and ended up in getting rejections again and again. So you should spend time to read the journal's requirement. Based on that, you have to edit your manuscript again and again. So recently, Elsewhere, Springer, they come up with like transfer of your articles. Once it gets rejected to other journals, they automatically transfer to other journals, so that your work is a bit less. So while uploading, you have to stick to the size of the table or JPEG format or PDF format. The format should be correct, and the size should not be more or less, and the images should be clear. And so once you have submitted, you will know the timelines on which the editorial board operates. So once you will get review, there are three possibilities. Either it will get accepted generally after minor or major revisions, or it will get rejected. So once you are being asked to do changes to address the queries of the reviewers and editors, you should be meticulous in writing this part is more important than writing the manuscript, because you should satisfy the reviewers and the editors, and you should answer the queries, and you should be modest in your replies. You should not be very authoritative, and there should not be an argument tone. And at the same time, you should not leave your stand. Like you should stand for your data and your observations. So in that, you should stick to the timelines. Generally, journals give 6 weeks to 3 months for giving your revisions and the next version. So you can write so this is a format by CORR for one of my article. Like I used to follow this for later journals as well. Even if they don't have this format, I myself create a document and write. So reviewers' comment should be on one side. What are all the reviewers like asking? So what are all the response by the author? It's like direct communication to the reviewers' queries. And in the last tabular column, the text changes whatever has been made in the initial manuscript subsequently before submitting for a revision. So with the line numbers, so that the reviewer and the editor will find it very easy when they see the second draft after revision. So rather than just writing, I've changed this text I have changed this figure. If you mention this line number is changed from previously it was this sentence. Currently the sentence is changed to this way. So it is easy for the editors and reviewers to like track whatever changes you have done. So I review like articles of a few of these journals. So common mistakes, as I told, the grammatical mistakes are like common mainly from non-English speaking countries like our country, and even Chinese journal authors and other Southeast Asian journal authors. Some are very tactical, and they use this English like article editing services so that they improve their English and send. Others they don't, and they end up in getting rejection. It's not only grammar is usually not the only thing for rejection, but still it is annoying for the reviewer and the editors. So you should focus on this grammar things. Spelling mistakes should not be there. So better don't use case again and again, because once I was sent by a reviewer that don't use dehumanizing terms like case. So you should write as patient. So better we also follow that for international journals. So if you write letters from 1 to 10, you better write it in word format, ONE 1, 2, 3. So after 11 or something, 11 patients, it's okay. For initially 1 to 10, preferably expand and write in words. And do not start a sentence with a digit. And generally don't use present tense in methods and results. So you have done the research earlier, so it should be mentioned in past tense. And there should not be any this contractions like apostrophe, don't, isn't, didn't. So that should not be there. And acronyms should be expanded in the first time. Like if you are writing MRI, magnetic resonance imaging, that kind of stuff should be done in first part whenever it appears first in the manuscript. That has to be expanded. While in the later areas, you can write the short forms. And the tables are preferably most journals expect it to be in JPEG format and not in the Word document. And don't repeat data again from the tables in the manuscript. And in the thesis, generally what people like, they publish their thesis in journals. Unless the journal is specifically meant for thesis publishing, most journals will expect thesis to be altered to the journal requirement. So in that, generally, like the students will write a single paragraph and full paragraph, and the last sentence they will write the reference. It is not so. Like you should have in a single paragraph, you should discuss multiple facts, and you cannot write only one reference for a paragraph or the entire paragraph. Better you discuss from various articles, and you can quote various journals. Well, there are so this is all from writing the manuscript to submission and to how to answer the reviewer's query. This is what Dr. Terence have mentioned earlier. And there is something called Equator Network. They have this checklist for various types of studies, from randomized studies to the from case reports. They have guidelines and that are mentioned here. So before submitting to the manuscript, submitting your manuscript, you follow this checklist and the manuscript guidelines. So the initial screening will be over. There are other tools like Enagmo Academy. They have multiple checklists for before submission. And I think most of the residents will be knowing this. Government of India has this NAPTEL courses. There is free course on biomedical research. Now the MGR University makes it, and many other universities like Ramachandra and Savita also made it compulsory for the students to complete this module before appearing for the exams. So to conclude, introduction of a manuscript is why did you start the study? So what made you, what is the thought process for you to start this particular study? And what is the lacuna in the literature and what you want to find out? And then the methods is what did you do to find out your results and to reach answers to your questions? And the results are what are your observations? And the discussion is what does it mean? So you have found out so and so. So what does it mean to the reader, and whether the reader can implement your research to their clinical practice? So that is what the discussion part. And conclusion is what is your recommendation to the ordinary reader? So this covers the basic manuscript writing and what all the contents to be added in each section of a manuscript. Thank you very much.